everyone, it's Dr. Russell, and I wanted to talk this week about a question I get a lot from patients, and that is, am I perimenopausal? How do I know? What does that look like? So it's something that women aren't really talking about so much, and my hope is that we have more conversations about it and women kind of share their experience of what it is like going through perimenopause. So perimenopause, in case you're not quite sure what that term is the time before menopause, so the time before your period stops. And that can be anywhere from 2 to 8 years before your period stops on average, but it can vary in length, and the symptoms can be really diverse. So sometimes it's really tricky and hard to tell. So I wanted to cover some of the common symptoms and not so common symptoms in perimenopause because there are a lot. And some of these symptoms do overlap with other conditions, so it can be really confusing. Is this perimenopause? Is it something else going on? So it's important to, have someone on your team to help you figure this out. But some common symptoms to start for perimenopause are fatigue, some weight gain, joint pain, as well as maybe mood changes, so maybe more irritable or anxious or even sad and depressed, even sleep changes, maybe some hair thinning or hair loss. And then the most common symptom, and by definition with perimenopause, especially early perimenopause, is period changes. So maybe they start becoming irregular, or you're bleeding more heavily, or you might miss a period here or there. So that's very, very common. And again, the definition of perimenopause. You might also experience impaired memory or brain fog, just really hard to think of things. And then there can be skin changes. So maybe dryness of the skin or kind of just overall changes in the texture of the skin. And these symptoms I just listed, yes, can be perimenopause, but they also can be something like hypothyroidism, which is common for women, as well as some other conditions. A lot of things can cause fatigue. So again, it's good to have someone evaluate and see if it actually is perimenopause versus something else. Some other symptoms of perimenopause can be headaches and migraines that either can worsen throughout this time or maybe just start. Urinary incontinence, so maybe when you sneeze or jump, have some leakage. Pain, pelvic pain, so pain with intercourse that maybe wasn't there before. And then dryness and changes in libido can occur as well. We can also not only get the hair loss, but sometimes have hair show up in places we didn't have them before, so maybe on the chin or on the chest, as well as some bloating and breast tenderness, which might make you think you're just having worse PMS, but it might also be perimenopause. So those are some more common symptoms, and then there's a couple other symptoms that are not so common or we wouldn't associate with perimenopause, and that can be one, burning mouth syndrome. So it feels like your tongue is burning, especially when you eat certain things. Can also have what's called formication, not fornication, formication, where it feels like bugs are crawling, which is a very weird and creepy kind of symptom. Might also have tingling or different kind of nerve sensations, maybe in the hands or the feet. We can have increased allergies as well as digestive disturbances. And then some women have even reported just changes in their body odor during that time. So that is not the entire list of symptoms. I don't want to just read a bunch of symptoms to you, but that is a lot of the common symptoms in perimenopause. So if you're having any of these symptoms, that might be a clue. The other thing is age. Perimenopause tends to occur on average. It starts around 45 to 47, and then usually menopause is around 51 to 52 or so. So that can be a clue. And then also if your mom, didn't have a hysterectomy, or if she's still around, you might just ask when she went through it. That can also be really helpful. So hopefully that was helpful to clear up some of the confusion around that. A lot of times women are already far into perimenopause before they know it and don't realize that's what's going on. But again, hopefully these are some clues to help you figure out if this is causing some of your symptoms, which we have lots of different options for. So thanks for tuning in, and I will see you next week.